Hello everyone, my name is Taryn Kaur and I'm the Managing Director and the Nursing Advisor for Future Building Nursing Prep Center. Today's video is in continuation to our webinar series, and before I proceed and tell you what this video is about, I would like to say heartiest thank you to all of you for sharing and liking and subscribing to our YouTube channel, and that gives us motivation to do something new all the time. So today's video is in regards to CPNRE exam. We get lots of requests from students that there is not much information available that how to prepare for CPNRE exam, and so that's why we decided that we are going to proceed with the presentation. Alright, so that's our presentation for CPNRE exam prep, and I'm myself a registered nurse and I am an educator, nursing educator from quite a few years now, and we are helping internationally educated nurses in achieving their dream to become nurse in Canada. So here is our presentation. So before I begin, I would like to give a little bit of introduction about ourselves, like who we are. And so FBNPC, in FBNPC, we have a mission and a vision. So our mission is to assist and empower internationally educated nurses to achieve their dream of becoming trained Canadian nurse. And our vision extends to be the leader in the industry and transform the way the services are provided with the use of technology and innovation. And we have been doing this by providing online classes, and we have been helping students globally. And this is the motto which was given by our CEO, Dr. Harpreet Sagar, and our motto for this FBNPC is that your success is our ambition. Okay. Now coming to the CPNRE exam. So what is CPNRE? CPNRE stands for Canadian Practical Nurse Registration Examination, and this exam protects the public by ensuring that the practical level, entry-level practical nurses possess the competencies which are required to practice safely and effectively. So this level of competence is measured in part by CPNRE administered by provincial and regulatory bodies, territorial regulatory bodies except for Quebec, which means that this national exam is applicable to all the provinces except for Quebec. Each province and territory is responsible for ensuring that graduates of practical nursing program in Canada and internationally educated nurses, those who are applying for LPN/RPN license, meet an acceptable level of standard and competence to practice as nurse in Canada. So another question which we very oftenly get from students is, where can we write this exam? So guys, you can write this exam only within Canada. So this is not like an NCLEX or an exam which you can write from your home countries as well. No, this exam you have to be present in Canada in order to write this exam. So we have pulled some interesting statistical data and courtesy to College of Nurses of Ontario. So this data comes from CNO. And if you look at the interesting passing percentage rate, the latest ones in 2018. So if you see here that the students who studied in Ontario, and you can see that their passing percentage is about 89.1% in first attempt. Whereas if you look here that the students who graduated from different provinces, they have the passing percentage of about 90.9% in their first attempt in CPNRE exams. So here comes the very interesting figures, guys. So if you look at the internationally educated nurses, in 2018, the passing percentage was 65.1. So if you see that there is a huge gap, like 90%, and for the Ontario students, like almost approximately 90%, and then the internationally educated nurses, which is 65%. So you can see that there is a huge gap in it. So now this section of the PowerPoint will help you to be successful by understanding the exam pattern and about its components. So first of all, what's the exam length? The exam is going to be 165 to 170 questions, and you have to attempt those in 4 hours. And nowadays it's a computer-based exam. You will get independent questions, which is 50 to 75%, and I will explain you in the next slides that what is the meaning of independent questions. Then we have case-based items, which is 30 to 50%, and this exam is developed to assess your understanding about the competency framework. Okay, so basically this exam is like they will be assessing your competencies. So for example, they will be assessing your knowledge about professional, ethical and legal practice. So that accounts for 20 to 30% of the exam. Foundations of practice, which is 55 to 65%, and collaborative practice 10 to 20%. So the tip is that if you can read the CNO RPN competencies, that can really help you to prepare for this exam. Next is, which is very important, and I was an internationally educated student as well, and then I transitioned and now I'm working as a nurse educator, as I said before in the video. So this is very important for you guys to understand, is about the cognitive levels, right? So the knowledge/comprehension based questions are only 10%. Okay, so what is the meaning of knowledge based questions? Is like basically it's your ability to recall previous information, right? So for example, if you know that what's a normal sodium level, so sodium level is 135 to 145 in a patient, serum sodium level. So if they ask a question directly related to that, like what's the normal sodium level, that's a kind of a knowledge based question, and those type of questions are only hardly 10%. The second type of questions which you come across as application based, and which you would see is the majority of the component is from that application based, is 55%. So application refers to how you apply your theoretical knowledge into the clinical setting, is called as application. Okay, and you can see that the majority content of the exam comes from that part. Then the last component is the critical thinking, and you can see that it accounts for around 35%. So critical thinking basically is identifying priorities while you're providing nursing care to the patient, evaluating the effectiveness of the care which you have provided to your patient, right? So when you think at a higher level, that's kind of called as a critical thinking. So I've already explained this, and in upcoming slides I will be giving you the examples as well. So we will be doing some example questions. So what you need to remember is that only recalling of the information or memory type questions are only 10%, right? So main focus of the exam is application and critical thinking. Coming to the contextual variables, so like 0 to 18 years, like minimum 10% of the questions would be from there, and majority of the exam accounts with the adult population, right? So 19 to like 100, right, basically. So adults and older adults are basically the biggest variables, I can say, for this exam which you need to study. So adult med surg, right? So that's kind of makes the whole integral part of this training. So I've got some sample questions for you. I hope this is gonna help. So this is a sample question, which is an example of independent question. So independent question, you can see that there is a question, and that's actually called as the stem, right? And we call that as stem in our language. And then you would see that there are options A, B, C, D. So those are called as distractors actually. Okay. So question is, and take a moment, think about it. So you can think the answers in your brain. So question is, Mr. Woodwin, 56 years old, was admitted with hypertension. His blood pressure was 190 by 120, drowsy, and was having non-productive cough. He has difficulty swallowing his medication. What would the PN do to help this patient? A. Sit him upright and try his medication. B. Crush the pills. Inform the physician about the patient's level of consciousness and monitor the patient's vital signs before administering the drug, right? So this is a standalone question, and the answer is, guys, C here. So now what you need to do is you need to break down the question. You have to see like what's happening. Patient has high blood pressure, 190 by 120. He's drowsy. He's also having cough, and the biggest issue here is that he has difficulty swallowing his medication. So as a practical nurse, what's your job is? You are identifying that patient has altered cognitive level here, and then patient is also exhibiting difficulty swallowing, and it is unsafe for that patient to take anything orally. So that's why you must inform the physician, so that maybe the physician can give you guys order for SLP assessment, which means the speech language pathologist, and then they can further figure out what we need to do with that patient, right? So independent question will have STEM and will have distractors. Okay. So this is an example of a case-based scenario. So case-based scenario is what the case will be given to you, and then you will have some questions associated with that. So if you can see that there is a case here, and question number 1 to 5 belongs to this particular case. So I'm gonna read the case for you. So Lola is a 34 years old African American woman, and who is in her second pregnancy and has had 1 live birth, no abortion, is seen for prenatal care at 6 weeks gestation. Her weight is 197 pounds and her blood pressure is 135/83. The patient's past OB history includes spontaneous vaginal delivery of 9 pound 6 ounce male infant at 40 weeks gestation 8 years ago in Kenya. The patient reports that the child is doing well. Her family history reveals that her mother has type 2 diabetes mellitus. So this is the case, guys, and you have to keep that case in the back of your mind, okay, while you're attempting the next 5 questions. So because you have to associate the part of the question back to the case scenario. So your first question is, when Lola comes in for a prenatal checkup, nursing assessment includes possible exposure to potential teratogens. Which factor should the nurse examine most critically, right? So A, type of teratogens, B, duration of exposure to teratogens, C, the week of gestation at the time of exposure, and the mother's physical condition at the time of exposure. Okay, so the answer is C, right? Because the first trimester, so here you're using your application, right, your theory into the practice. You know that during the first trimester, what happens? The fetus is developing. All the organs are basically developing in the first trimester, so it's called as organogenesis. So this is the period where the major organs are developing, and if the mother gets exposed to any kind of teratogens, which means any kind of radiation, any kind of chemical exposure, so it can cause the birth defects in the child. Okay, so this is how you basically attempt the case based questions. Now coming to the point, like again, knowledge-based question, which I told you are very less, only 10% in the exam. Knowledge-based is basically recalling the information. So which can be straight lab values, straight definitions. So like which is you remembered it and now you just have to like recall it back in the exam. So for example, a father expresses concerns about his son's upcoming surgery. The nurse listens to the father's concern and validates his feeling. What component of nurse-client relationship is the nurse demonstrating, right? So is it trust? Is it respect? Is it empathy? Is it professional intimacy? So this is a direct definition, and the answer is C, guys. So this is empathy, right? So as nurses, it's expected from us that we should be empathetic towards our patients and their families. Next is the application-based question example. So I'm going to read this question for you. During the admission procedure, Mrs. Martha states that she has frequent urinary tract infections. What should the practical nurse recommend to Mrs. Martha to address her recurring infection? A. Drink more fluids, void frequently and maintain good hygiene. Take antibiotic, drink plenty of cranberry juice. C. Finish all her antibiotics and then collect a urine sample for analysis and notify her physician about her recurrent UTI. So guys, what you need to do is you need to break down first, right? So look here. So answer is A, but I'm going to explain you why. So here what's happening is Martha is asking recommendation from the practical nurse. So this means answer is something which is within your scope of practice, right? So can you say that you can take antibiotics? No, because that's not your scope of practice. That's physician's scope of practice. C. Finish all her antibiotics and then collect a urine sample. That loses the purpose. You're not recommending anything to the patient, right? So this means option B is gone, option C is gone. D. Notify her physician about her recurrent UTI. This seems like an option, and sometimes students, they do get confused between A and D, but look at it. You need to do recommendation in your scope of practice, right? So of course, we can always encourage the patient to have more fluids, void frequently, and maintain good hygiene, right? So that's why your answer is A. Next type of question is critical thinking question. So critical thinking is like when I said that thinking level becomes a little bit more complex, you're applying 2 to 3 basically applications together in one question is called as critical thinking. So for example, the question is, the physician visits Mrs. Gupta, who was admitted 5 days ago with abdominal pain and a diagnosis of diverticulitis and a bowel abscess, right? So you can see that there are multiple things given in that, right? So patient has abdominal pain, patient has diverticulitis, patient is also having bowel abscess. On admission, vital signs were temperature 36.5, heart rate 82, respiratory rate 18, blood pressure 120/64, and orders are as follows. So doctor has prescribed full fluid diet, morphine 5 to 10 milligrams every 4 to 6 hours PRN for the pain, and he has also given you orders to increase the IV rate to 125 ml per hour and activity as tolerated. So what order should the practical nurse question, right? So here you can see that what's happening is basically you are evaluating and reflecting on the whole scenario, okay? And can you guess answers? So the answer is, guys, 3, full fluid diet. So what the nurse should know is, sorry, I'm going to go back. So the nurse should know that patient is probably presenting with sepsis here, right? Patient is having abdominal pain, diverticulitis, bowel abscess. Though the vital signs are normal currently as per scenario, but patient is also in such a pain that patient is being given morphine, right? So these kind of patients, that's kind of your critical thinking is, we need to give rest to their bowels, right? So the patient should be technically NPO at this level. So you can question the full fluid diet, right? So why international educated nurses sometimes make mistakes is because the countries sometimes where we come from, we cannot challenge a physician, right? So that's something which I've seen from my experiences, that students struggle is because they think that they cannot challenge the physician. So it's a kind of a gentle, so it's a team approach here in Canada. And what we need to do is, it's not just by challenging is you can coordinate and you can always clarify if you're unsure of something, right? And in this case scenario, it's kind of, that the patient shouldn't be on full fluid diet, so you can do the consultation with the physician. So here are some resources for you guys that you can use to prepare for your exam. Like Fundamentals of Nursing, Potter and Perry, and Bruners and Siddharth. This is the Canadian standard books which are used in majority of the nursing colleges here and universities. So that's the standard. If you want to know in detail your foundations, you will find it in these 2 books. And then there is a comprehensive book which is called as NCLEX PN. So remember, not NCLEX RN, NCLEX PN is something which you can use to prepare for your LPN exam. So how we can help you is, we help our students in understanding the concept and mind mapping. We practice lots of case scenarios, and this brainstorms your critical thinking, right? What are you going to do as a team? What are you going to do if the patient is having this, right? And we emphasize a lot on Canadian nursing ethics, right? We all come from a different culturally background, right? But here, what we need to follow is, we have to follow our standard guidelines and protocols and ethical practice to help and support and advocate our patients. So we have 2 kinds of programs which we run, and so we have comprehensive program and the crash course program. So in comprehensive program, we provide detailed theoretical lecture, and we have database over 5,000 questions and multiple mock tests. And for crash course, it's like 7 days program. We primarily focus on multiple choice questions and the strategies, right? And we just do the theory highlights and mock test in that as well. So these are based on the different needs of the different students. These 2 courses are designed, and I'm very proud to say that FBNPC has accomplished, we are above 95% passing rate for our LPN students in both the programs. So these are some of our lovely successful students from 2019. So another interesting thing, I'm not sure if you guys are aware of it or not, guys, CPNRE exam is changing. Yes, absolutely, it's changing. It's changing in 2022, and British Columbia and Ontario will be the first pilot provinces, so it's going to be like really interesting. So they are going to work on that. They are actually working. They have formed some committees and they're working on that. So please follow us on our Facebook pages, on YouTube, on Instagram, because we will be updating you guys soon as we are gathering much more information about it. So I would say thank you very much for patiently listening to us, and I hope you find this video helpful, and this gives you a perspective that how you have to prepare for your exam, what's your clientele, so adults. I'm just kind of doing summary here. Lots of emphasis on application and critical thinking questions, and as I said, it's more on competencies, so professional, ethical, collaborative competencies. So that's what you need to focus on in order to pass your exam in flying colors. So if you still have any questions, feel free to contact us on www.fbnpc.com, or you can throw us an email at nursingprepcenter@gmail.com.